Living with trauma. Living with trauma can profoundly impact a man's mental health, manifesting in various emotional, psychological, and physical ways. Trauma, whether stemming from childhood experiences, abuse, loss, war, accidents, or any other distressing event, can leave lasting scars that affect a man's daily life, relationships, and overall well-being. Here's a detailed look at how trauma can affect a man's mental health. 1. Emotional dysregulation. Increased anxiety. Men who have experienced trauma may suffer from heightened anxiety. This can be generalized anxiety, social anxiety, or specific phobias related to the traumatic event. The constant fear of reliving the trauma or encountering triggers can be exhausting and debilitating. Depression. Traumatic experiences often lead to feelings of hopelessness, helplessness, and worthlessness. A man may feel like he is stuck in the past, unable to move forward. Over time, this can result in major depressive disorder, characterized by persistent sadness, a lack of motivation, and loss of interest in activities once enjoyed. Mood swings. Men with unresolved trauma may experience mood swings. They may be irritable, angry, or tearful, which can make them appear volatile and difficult to understand. This emotional instability may come across as erratic behavior, leaving the man feeling isolated and misunderstood. 2. Cognitive effects. Intrusive thoughts and flashbacks. Trauma can cause vivid flashbacks or intrusive memories of the event. These can disrupt a man's daily life, leading to concentration difficulties, reduced productivity, and emotional exhaustion. The man may relive the trauma as though it is happening again, making it hard to focus on present tasks. Negative thought patterns. Trauma can instill a pervasive sense of pessimism. The man might begin to see the world through a lens of fear, mistrust, or cynicism. This negative thinking can cause problems with relationships and prevent him from seeing opportunities for healing or growth. Cognitive distortions. Men with trauma might develop cognitive distortions, such as overgeneralizing, I always mess things up, catastrophizing, something bad is going to happen, or black and white thinking, I'm either perfect or a failure. These distorted thoughts can perpetuate feelings of inadequacy or doom. 3. Behavioral impact. Avoidance. A common response to trauma is avoidance, where a man actively avoids situations, people, or places that remind him of the trauma. This can be seen in avoiding social gatherings, not talking about past events, or even avoiding therapy and help-seeking behaviors. Avoidance may provide temporary relief, but it only prolongs the trauma's grip on his life. Substance abuse. Many men may turn to substances like alcohol, drugs, or even overeating to numb the pain of trauma. Substance abuse becomes a coping mechanism to temporarily escape distressing emotions or intrusive memories. Unfortunately, this often leads to addiction, health problems, and worsened mental health symptoms. Hypervigilance. Living with trauma can make a man overly alert to potential threats. This state of hypervigilance might cause him to constantly scan his environment for danger, or feel that he is always under threat. It can lead to sleeplessness, irritability, and an inability to relax. Aggression or violent behavior. Trauma, particularly unresolved or complex trauma, can sometimes result in increased irritability and aggression. Men may find themselves lashing out verbally or physically, which can strain relationships and lead to feelings of shame or guilt afterward. 4. Social and relational consequences. Difficulty forming or maintaining relationships. Trauma can deeply affect a man's ability to connect with others. Trust may be shattered, and there may be a deep sense of loneliness, even in a room full of people. Trauma survivors may avoid intimacy or feel disconnected from others, making it difficult to form close friendships or romantic relationships. Emotional numbness. Some men may struggle with emotional numbness, feeling disconnected from their own emotions or the emotions of others. They may appear cold or distant, not out of a lack of care, but as a defense mechanism to shield themselves from further emotional pain. Parenting challenges. For fathers, unresolved trauma can also affect their relationship with their children. They may be overly protective, distant, or overly strict. Trauma might impair their ability to be emotionally available or responsive to their children's needs, potentially perpetuating unhealthy family dynamics. 5. Physical health issues. Somatization. Trauma often manifests physically, even if the person isn't consciously aware of it. This could include chronic pain, headaches, gastrointestinal issues, or heart problems. The body holds on to trauma, and chronic stress can weaken the immune system, increase blood pressure, and lead to long-term health issues. Sleep disturbances. Trauma survivors often suffer from insomnia or nightmares. Sleep disturbances, such as difficulty falling asleep, staying asleep, or waking up from nightmares, exacerbate mental health symptoms, leading to further cognitive impairments and emotional dysregulation. Fatigue and low energy. Living with trauma can be exhausting. The constant stress, vigilance, and emotional turmoil can lead to chronic fatigue. The mental and emotional toll can drain energy, making it hard for a man to function normally, leading to further feelings of inadequacy and frustration. 6. Impact on self-identity and self-esteem. Guilt and shame. Men often feel guilty for not being able to protect themselves or others during traumatic events, or they may experience shame related to the trauma itself. This guilt and shame can erode self-esteem and cause the individual to feel unworthy of love or success. Identity struggles. Trauma can cause men to question their sense of self. They may feel like the person they were before the trauma is no longer who they are. This identity crisis can manifest in confusion, disillusionment, and existential anxiety about life's meaning and purpose. Imposter syndrome. For some men, the effects of trauma lead to imposter syndrome, where they feel like they are pretending to be okay or pretending to be successful. This can create a sense of deep inner conflict, where outward success and achievement are undermined by feelings of internal failure. 7. Social stigma and gender expectations. Pressure to conform to masculine norms. Men often feel societal pressure to man up or hide their emotions. This can make it harder for them to seek help or express vulnerability. The cultural expectation that men should be strong, stoic, and in control can prevent them from acknowledging their trauma or getting the support they need. Isolation, due to gendered expectations. The reluctance to open up about their trauma, coupled with the stigma around men expressing vulnerability, can lead to social isolation. Men may feel they cannot talk to their friends or family about their experiences, leading to loneliness and a lack of emotional support. Conclusion. Living with trauma is a complex and multifaceted experience. It affects a man's mental health in a wide range of ways, impacting emotional well-being, cognitive functioning, physical health, and relationships. Left unaddressed, trauma can lead to a downward spiral of deteriorating mental health. However, with the right support, including therapy, peer support, and sometimes medication, men can heal from trauma and reclaim their mental health. Addressing trauma often requires patience, self-compassion, and a willingness to face difficult emotions, but it is possible to rebuild a sense of stability, resilience, and well-being. Talk to your doctor. They can give you excellent advice, help, and guidance. Don't be scared of reliving it. The way out is through. You owe it to yourself to be happy and free from past trauma.